What's up YouTube? Welcome back to another blog. I'm Shravan. You are watching my YouTube channel skmbackpacker. So guys, जैसे कि पिछला वीडियो आप लोगों ने देखा कपिंग थेरेपी का मतलब मैंने दिखाया था अपने दोस्त यार के साथ फन थोड़ा बहुत प्रैक्टिकल। बट इस वीडियो में आप पूरा 1 घंटे का पूरा फुल लेक्चर वर्कशॉप का पूरा लेक्चर देखोगे जहाँ से आप पूरा कपिंग थेरेपी जो है सब कुछ सीख सकते हो प्रैक्टिकली लाइव पेशेंट पे। तो इस वीडियो में पूरा देखिए आप लोग, अगर आप मेडिकल फील्ड से हो तो जरूरी आपके लिए बेनिफिट होगा ये वीडियो। तो चलिए देखिए, वीडियो ऑलरेडी लंबा है, मैं ज़्यादा लंबा नहीं करना चाहता हूँ।
Yes. So we'll go through that. Ligamentum graphy. Almost this is the curvature of the muscle. So how this will be working? So first we have this lap 1, which is the neck area, major muscle, the capitatus group, and then the superficial trapezius, and then we have this area. The upper fibers, middle and the lower. So upper will be the second lap and the third lap will be this. Right, so in the upper fibers, what we have to do? So 2 cups over the spine are compulsory. Right, पूरी spine पे हम कहीं पे cups नहीं करेंगे. We'll go paraspinally, but on spine we are having these 2 points. Right, the first one is the C71 junction and second is your L5S1 junction. Right, so these are the 2 points will be applied for, like if you are working upon this area you have to apply this, and if you are working down to this area go for this cup. So the first will be at the trigger points of traps. So this is your lap 1 which will be applied over this area, and then we have dynamic cupping also. So we have to go with the both procedures at a time. So you will be getting these 2 things in your cups also. So you have to apply this over the shorter side, the longer side and the shorter side. Apply this over shorter and second is over longer side, and choose the smallest cup of the lot for dynamic cupping. I think number 5 or 6, right? So you have to take this, and static cupping will be applied over here. One, three. This will be the protocol for your upper traps, right? And then we have middle and the lower. This will be the application, the lap 1 for the trapezius, right? And then we have this lap. After this we'll do, right? Start performing the cervical traps lap, right? 1 minute testing. After testing, if you are getting any other color, you have to do that later. But now as we are practicing only the static cupping, so you have to go with this for next 5 minutes, right? Start कर दीजिए.
Now practice time.
So lubrication we have to apply. So just place the cup and go with a single pump. Hold this, right? And then start holding the cup.
Dynamic.
Yeah, the dynamic cupping. So dynamic cupping most of the time we are doing for the irregular surface, right? The dynamic cupping, silicone cupping, both will be applied for, and the strokes you have to do 10 to 15. Yeah, 10 to 15 times you have to start from here and move toward the spine of scapula. The lap one, and then we have toward this chain. The straight chain for upper, middle and lower traps. Application, and now movement. Movement down toward the T12 where your trapezius settles. Right?
Muscle fibers.
Yeah, along the muscle fiber you have to go. Right? So these are the two grades which we have to follow. Along with every patient, those who are having problem with the radiculopathy or this. So in radiculopathy, what you can do? You can go to and fro method. You can use to and fro method to release this area. From here, your nerves are arising and go into the hands, right? So you can go the to and fro method for this area, right? Yeah. Now, sir, move. And you can check the skin reaction. Yeah. Right? Are you able to see the skin reaction? The stagnation is not that much high. So if you apply the static cup over grade 3, it will turn into blisters or purpura, and that will be painful. So whenever you are getting the grade 3, you don't have to go for static cupping. You can either move to the dynamic or move to the wet. If your patient is not acting for the wet cupping, just go for dynamic then. But at that stage, we require the wet cupping. We have to remove the toxin from the area, then only it will work, right? So start with the lap 2. Having muscle over the scapula, protecting the humerus, right? And the pectoral. Pectoral is also included in your shoulder protocol. So we are starting with delt, then pectoral, and then we'll move to scapula. Right? For this, the patient has to be in neutral position. One cup over the joint, right? One over your posterior aspect, one is in the anterior aspect of the joint, and one in the muscle belly. And 1 cup over this tuberosity region. Why? When we are working over the radial neuropathy, radial nerve neuropathy, we have to add this, right? So this will be the full cupping. So if you are going every side of the joint, it will give you a good infiltration. So these front and back cups, they are giving you infiltration toward the joint as well as toward the muscle also. 1 cup, we have to go over here as your tuberosity, or you can say the radial nerve cup, right? And then in accordance, we have to go till here. So this is muscle as well as your nerve cupping, radial nerve cupping. So it will be started from this edge. The last we have did. So you can go with the static. Here you can go with dynamic. And in the continuity with this. Right? So this is your delt as well as your radial nerve static cupping. You can go with, next we'll do for dynamic as well. Right? Start. Right, so these are the chain lines for your dynamic cupping. Right, so you can combine with the whole chain treatment, right? So 15 to 20 strokes you have to maintain for the whole chain. Right? So this is the dynamic for your deltoid. You can do this in post-fracture stiffness, deltoid strain, or if you are getting grade 3 or onwards. Like he is getting grade 3, exact over the shoulder. So you can directly perform this dynamic and wet over the surface. Right? Start for the dynamic. So in a single I am drawing the cups and the dynamic one also.
Okay, sir.
Right? 1, 2. Upper, middle and lower fibers. This is your clavicle. Right? Upper, middle and the lower fibers. And here the same upper, middle and the lower. So cupping application will be 1, 3 and 1 anterior cup. That is permanent for the shoulder, right? Then for the lower fibers. Yeah. And then for dynamic, you have to go along the chain toward the point. So this point will be always static, anterior delt. Yeah. You have to continue with this, the chain for the dynamic, and these are for the static ones. Condition, round shoulders or any posture related issue. You have to be. Like most of the time, like frozen shoulder, what I have seen, the patient has a crouch posture.
Yes.
So in the crouch posture, their retractors are weak and the pectorals are extremely tight. So you have to release them. You have to go for the cupping and the digging for the pectorals. Or sometimes you will get the patient with pectoral strain. Like there are a lot of exercises for pectoral lifting, barbells. So in those conditions, your patient can get a strain. So you have to go for that, right? Application start karte hain. Like for dynamic, we'll go for the same. Take and move along the chain, right? 10 to 15 strokes.
Inner to outer.
Yeah. Not inner to outward, you can say into the muscle integration or where the muscle fibers are going. Pectorals are directly going towards the shoulder joint. Yeah, same. And you have seen in deltoid, fibers are going away from the joint. So we are going, like what is the reason? We can go opposite also. But what you will feel, you are feeling a lot of obstruction. So with this process, we are integrating the fascia into the same line. Otherwise, if you are going opposite, you are disintegrate or wrinkling the fascia again. You are setting the cross links into straight links. You are deactivating fascia. That's why always be in the formation of the fibers. That will be a little good procedure for getting results.
Used the muscle fiber जा रहे थे.
No, वहाँ पे भी हम almost same जा रहे थे.
Perpendicular या parallel?
See, that was the stroke type.
अच्छा.
वो stroke type था almost like that one is the only जो आपका था stroke.
वो perpendicular.
Yeah, always rest are parallel and all are in the same chain.
मतलब हमें हमेशा muscle के fiber.
Yes, you have to always go with the same integration of the muscle fiber. Otherwise, they will get strained or they will get inactivate. Like you have to cover the lower also, that will be fine. For the female patients, the major problem, so you have to lift the hand like this. So you can easily go the upper, but for the middle and the lower, you have to go over the border side. Right? You have to go along this surface for meeting the medial and the lower border. Right? This will be for female patients. Clear?
Yes, sir.
Yeah, start. Over on scapula and over scapula, over the scapula, right? So these two things we are having. So we'll 1, 2 and 3 lats. We'll go for that, right? So first I'm going for the scapula. One posterior cup, जो हमने अभी posterior delt पे किया, that is common. 3 cups over here for infraspinatus, and then we have for the same थोड़ा सा बेंड करिए सर. Yeah. For this, the chain go toward the shoulder joint. Similar, from here 2 chains will be going toward the shoulder. Right? So this is for your static and this is dynamic.
Dynamic.
Right? So for dynamic, apply and move toward the shoulders. Right? Continue strokes. ऐसा नहीं कि आपको इसी वापस आ जाना है. If you come back with the same pressure, it will de-wrinkle the fascia or deactivate the muscle. Second, for the inverse meniscus, go toward the shoulder joint. Right? Or you can apply the cup over here. You can go toward the border also. With the same border, you can go, because few people will complain you about the border also.
Yes.
That at the border they are getting the pain, right, over the bone. So you have to go toward this and move toward the shoulder, right? And these chains are there, 1, 2, 3 and 4, right? And then we have the static part. Yeah, 1 cup application over this region. Yeah, like you have to use the smaller cups for this. एक छोटा cup. One over the lower border, right? 3 cups for the infraspinatus, 2 for the supraspinatus, and 1 at the posterior delt point.
नहीं सर अभी नहीं हुआ.
फिर गिर जाएगा.
गिर जाएगा.
Yeah. Right? Start the on scapula cupping, static as well as dynamic. Right? So now we have to cover this much of the area. So we are covering the rhomboids, the few fiber of lats, and teres major minor for outer scapular pattern. So outer scapular pattern will be probably used for your rotator cuff injuries, right? So most of the time, how these injuries got developed? Like, what is the reason for a supraspinatus tear? What is the probable reason? Impact of
गलत
injury?
तरीके से अगर किसी ने
Yeah, overhead, hand injury, fall, any kind of trauma. But like in games, in sports field, how people are getting frequently supraspinatus tear. Muscles are tight, and now with the impact of an injury or a force, that the tendon got some tears. But if you relax these muscles, there will be then the chances will be decreased for getting the injury. But we can't say about the impact of the injury. Sometimes it can be very higher. So whatever muscle is relaxed, it can be tear, right? So you have to be connect. You have to connect the muscles during the treatment also. So we are using 1, 4 over here at the lower tip, 5th for your teres major minor point, and these will again set up into the posterior part of shoulder. Yeah, so we have covered the rhomboids, a few part of the lats, and teres major minor. If you use a smaller cup, you will probably over the teres major minor, right? So dynamic, right? Dynamic will be over here. You will release the rhomboid major minor, right? And then you will go for the teres major minor, rhomboid major minor, teres major minor. For major minor, you will be going toward the shoulder with the dynamic cupping. Clear?
Yes, sir.
Yeah, start. Next we have the lats protocol. Like why we are more concerned about the lats? सर कुछ significance जो आप जानते हो lats के बारे में?
सबसे बड़ा मसल है बैक का.
बैक का बड़ा मसल है. And you can say that is the major culprit that your diabetic patient or the PA patient not getting the range. एक बार से setting में आ जाएंगे. Yeah, same. Just if I pull over here, sir एक बार हाथ pull करके देखिए. See? The patient has to make a lot of effort for getting the range. Same thing I think happening with your patient with PA, right? The same problem है. वो lift तो कर लेते हैं, but they put a lot of effort. So the major reason is over this area. This area, the fascia is very much thick than your other muscle. We have a bigger area having the more integration of fascia. So this will help you. This muscle group will help you to get a good range in your patients, right? So front line. Yeah, so we'll start the marking. Scapula, right? I think you are able to see the curvature.
Yes, sir.
So hand will be a little more moved.
Clearly visible.
Yeah, this is your lats. So we'll go for the same for the both sides. And then we have the thoracolumbar fascia. This is the spinal column. So whole will be covered in a same segment, right? Same, right? So when we are doing dynamic, we'll start from here and go toward the end, right? Same from here, we'll go toward the end over here for dynamic. And then for static, we can use a little bigger cups for here.
It was it.
Go with a small cup. Right, so this will be the static application when you will apply when your patient is not getting the range. Right? You are doing mobilization or whatever you are doing, stretchings with the joint, but this you have to add for getting a good range. And similar, you have to go with the dynamic protocol also. So he is having almost which grade he is getting? Almost like
Second.
all the cups now
Second.
still like in grade 2. Maybe if you can turn into grade 3, like
This one.
these are like 2. Yeah, take the picture and start doing for lats, dynamic and static. Right, so one cup we over at the L5S1 junction, right? And paraspinally we have to go. And the upper parts of the glutes. Here we have to also go for the second. And the movement will be downwards for the dynamic one. And for here also, you have to go over this line for upper glutes, right? right? And you can continue this treatment for ankylosing spondylitis also. You have to go the whole paraspine at a time. But if your patient is having any problem, like any disorder, then you have to go in a segments. You can go with this lap, then this and this. Yeah. So till this is your low back protocol. If you add this whole, this will be for the ankylosing.
सर इधर लगाने की जरूरत नहीं है।
यहाँ पे भी पड़ जाएंगे सर, वैसे ना अपर ग्लूट से पूरा का पूरा। Here, and इसके बाद लोअर शुरू हो जाएगा प्रॉपर लंबर रेडिकुलोपैथी, राइट? आप ये शुरू करिए, फिर लंबर रेडिकुलोपैथी करते हैं। This is Achilles tendon. Over Achilles tendon, you have to only go with dynamic cupping. Over here, you can go to and fro because the fiber is very thick, right? You can stretch out the leg and go for the dynamic for this, right? Static placements and for dynamic. Yeah, right? And then we have for the soleus. So for soleus, placement will be a little oblique, right? So here is the placement and dynamic will be toward the same line. Soleus, gastrocnemius. Yeah, these are your statics and dynamic you know, right? Start doing trochanter, right? So यहाँ तक तो हमने देखा points were there, right? From here we have to go toward the trochanter. So one point will be applied over here, over trochanter. This will be for dynamic area, the tendinous region for dynamic, right? So we'll put, if someone is having piriformis syndrome, we'll start from the trochanter and go with the whole chain. If someone is having PIVD or herniation in the back, we'll start from this region, right? Or if someone is having the same ankylosing, so start with there and end over here. Right, so one cup I am putting over here. The trochanteric region. And most of the time you will see patient develop only this much of the pain. Right, that is because of the piriformis. So this can be the distribution for your bicep femoris and the semitendinous membranous. So IT band, bicep femoris, calf, soleus. So you can put cups over here also, so you can take the picture and get the idea of the sciatic cupping, right? And for the dynamic, you have to go down along the chain, right, over these cups, right? Same you have to go with the dynamic, and over here dynamic compulsory over the tendon. Start, and dynamic will be to and fro. उसको टाइट करो. एप्लीकेशन फॉर द IT बैंड, राइट? इसके बाद करते हैं हम क्वाड्स. एंड देन शिन स्प्लिंट्स। फिर हमारा स्टैटिक खत्म हो जाएगा, विल गो फॉर द फायर।
सर डायनेमिक में ऊपर से नीचे की तरफ
डाउन टू एंड फ्रो।
टू एंड फ्रो।
Yes. Right? And over this point, properly will be wet, we have to go for.
नहीं यहाँ था इसमें hamstring।
Yeah, ये wet
hamstring में
रहेगा।
सर नीचे ही था ना, यहाँ से ऊपर से नीचे।
वो यहाँ से यहाँ शिफ्ट हो चुका था।
हाँ
ये
डायनेमिक
ओवर प्रॉपर वो है।
कौन
That is straight.
सिर्फ IT बैंड में ना 2 and
Yeah, only IT and to and fro.
क्वाड्स।
1 cup over here, 2 cups over the joint line, medial and the lateral। जो मैंने अभी lateral आपको बताया, same medial पे ही point रहेगा। And for the rectus femoris, right? And this is for the vastus lateralis, right? ये points तो हैं ही already। And then we have a shin splints। Shin splints direct over the bone। सबसे favorite patient, बहुत जल्दी हो जाते हैं, 5 मिनट के अंदर अंदर खत्म। This is specifically for the wet। Shin splints कभी कोई मिले, फुटबॉलर, एथलीट या कोई भी, go for direct wet।
इसमें टू एंड फ्रो होगा सर डायनेमिक या डायरेक्ट
हाँ डायरेक्ट
नीचे की तरफ।
नीचे की तरफ। जिनको सर्विकल प्रॉब्लम है C71 वेट कपिंग जरूरी है, और किसी को नी में थोड़ा सा एक्सर्शन है तो दे कैन गो फॉर द मीडियल साइड ऑफ कपिंग वेट specifically। राइट, सो यू कैन यूज सर्कुलर कप्स आल्सो हियर। जो कर्व्ड कप्स हैं वो आप यूज कर सकते हैं। ये लीजिए, दिस इज द प्रोटोकॉल फॉर क्वाड्स एंड शिन स्प्लिंट्स। तब तक या तो टेंडन घिस चुके होते हैं, लिगामेंट्स में प्रॉब्लम आ चुकी होती है, या फिर बोन की जॉइंट फॉर्मेशन, आपका टिबिया फीमर भी कई बार जुड़ना शुरू हो जाता है। अगर पेशेंट इज हैविंग थायराइड में आपकी पेशेंट की बॉडी का कैल्शियम अच्छे से रेगुलेट नहीं होता, तो दोज हु आर हैविंग थायराइड प्रॉब्लम दे get the more problem with the spurs or the bony overtones, right? So next we have the ankle। Okay, you can come over here। Like ankle में ankle sprain, आपका deltoid ligament tear, so these things we are having। and tarsal tunnel syndrome, कई बार पेशेंट्स मिल जाते हैं, यूजुअली बहुत कम देखने को मिलते हैं बट मिल जाते हैं फिर भी। and the foot has a regional belief also with Islamic concept of wet cupping or known as hizama, right? So this spot was very important according to regional belief। Otherwise there is a condition called tough toe you will get in the footballers, kickboxing athletes, you will get these things very easy। So what is the problem? This joint is got inflamed and this put effect over the whole toe chain, right? पूरे toe chain में problem डालता है। when they put their feet they get the pain over this surface, right? Also I experienced the same pain because the thumb got stuck into something and the whole foot was like in extreme pain। So I put a 1 cup over here and did the wet cupping, like it was within few minutes got relief, like। and one more thing, Islamic belief also, according to Islamic belief this point is very important for wet cupping, right? And then we have for the just down to the trochanter, this surface, right? So this surface we have to also do deltoid ligament। and for your tibial ankle joint infiltration, this point you have to go for। and third, if someone is having tarsal tunnel, so here a lot of nerves are passing through from this surface, so you have to go for this also। this will work over tarsal tunnel as well as your spur, right? Yeah, these are the 3 points which we have to cover for any injury। For every injury you can cover all 3, they will give you ultimate benefit, right? You can do static as well as wet, like wet ज़्यादा better है, static में इतना मज़ा नहीं आएगा आपको।
सब वेट के लिए पॉइंट
Yes, sir?
नहीं है बहुत जल्दी.
Right, so what we need for the fire cupping? A cotton ball, alcohol or any flammable substance, right? And a sponge forceps, right? Matchstick. Right, so the safest of the lot is the bamboo cup. You can use it for a long time and very easy to use. Right, so like this you have to prepare the setup. And now how to perform the fire cupping? So we have two methods, either touch the base, right? Touch the base and up. Right, so either touch the base and place. See, the vacuum is created. Same for the horn cupping. So these are not actually horns. Or the third one,
Glass.
move over the surface. See, move the fire over surface and apply. Right, rotate. See, either touch the base and make sure you don't over soak the cotton ball. आपने over soak कर दी, cup can fire the cup can catch the fire also. Right? So these are the methods. Points आपको पता ही हैं. एक एक करके आइए, शुरू करिए.
Which one is better, wet cupping, fire cupping, or the
Wet.
Wet.
Yeah. But you have to mix up the treatments.
But it's just for the placebo effect, or it's
Yes.
just add on the additional
Placebo.
effects? Placebo.
Like other treatments are just for the placebo.
The cupping is same. These are just for the show off to
Yes.
attract the patient.
Yeah.
Okay.
Touch the base. फटाफट apply. Yeah. See. Rotate over the walls. Apply. ऑन कप थोड़ा मुश्किल है बिकॉज प्लास्टिक है तो कई बार नहीं हो पाता.
बैठा नहीं
बैठा नहीं रहता.
बड़ी वैसी अगर रिमूव नहीं कर पा रही
हटा देते हैं तो रिमूव कर लगाते हो गया.
Come this side. Hold this camera. I will do it.
ट्राई और वाला ट्राई थोड़ा कॉम्प्लिकेटेड.
Authentic जादू.
Yeah, I know it's called cupping, but it's staying.
अभी देखिए आप आयशा मैम का जादू.
Then 2 to 3 days.
ये नहीं हो रहा यार. ये वाला
Right, so we are following the first pattern. Matches किसके पास है?
Matches.
Right. The pattern number 1, right? So next is for your ankylosing. If someone is having ankylosing spondylitis, so then they have to go for this. Like same pattern you have to follow, right? Now for low back pain. Right, this is for the low back pain. सर घूम जाइए. नेक्स्ट हम करते हैं शोल्डर पर. And one for the tuberosity. See? Clear?
Yes, sir.
मेजर हमने कर लिए. शोल्डर, बैक, सर्विकल, नी के लिए भी आप कर सकते हैं. ओवर द क्वाड्स, वन एट द मिडिल साइड.
Can we do for the iliopsoas muscle or the abdominal?
सेम एब्डोमिनल के लिए कर सकते हैं, बट द थिंग दैट द फैट डिपोजिशन इज देयर, तो पॉसिबल नहीं होगा. राइट, ये लीजिए, एक एक ग्रुप करके आ जाइए, अपना मॉडल लेकर यहीं पे परफॉर्म कर लीजिए. कब बहुत है.
अभी होएगी हिजामा यानी कि वेट कपिंग लास्ट.
So sterile the region, sterile your hands. Make sure maintain a sterile facility during the treatment. Right? A pump. Right, so first we'll check the stagnation. For 1 minute. Yeah, same. So already we know he is having a grade 3. So we can directly go for wet cupping. So whatever the condition is, we can go for the wet cupping, right?
ऑयल हार्म नहीं करता अगर कट लगाए?
नहीं. This will make a process little smoother if you are providing oil, right? So we'll place the cup with oil for more few seconds. Till then, we'll prepare the blade. So elongate the skin and make scratches.
Roshan, is it painful?
Little bit.
Elongate.
दुख रहा है.
सर्कल कितना फाइन होगा?
Scratch, only a scratch, not a proper cut. You have to just scratch it. just to break a barrier between the toxin and the skin.
Oh God.
Right, wait for 6 minutes.
6 minutes.
Yes.
Brown blood. Brown blood, not red.
Toxic metabolic waste rich in calcium, waste magnesium and nitric solids. You can say similar to the compound like uric acid.
Oh my God.
Yeah.
पेन हो रहा है आपको?
नहीं,
बिल्कुल नहीं।
दर्द हो या
ऐसा कैसे हो सकता है?
नहीं होता है।
जलन हो रही है?
कुछ
Hizama, the points are same or the different?
A little different. Recent ADLs or the vitals are very much stable during the treatment.
So I have a question. I don't know, but I think I can recall there was a time that they did hizama in the
Ankle.
leg.
Okay.
It's possible.
Yeah, possible you can do.
Okay.
इसमें thoracolumbar में fascia है, proper muscle कहाँ है?
Record.
Right? This is the toxin. Blood आ चुका है सारा का सारा कप के अंदर.
This is bad blood. Roshan, thank God.
Yeah. This gelatinous substance is the toxinated blood.
Oh, the place is even light now.
अगर कब भर जाए ट्रीटमेंट
दूसरा कप लगा
फिर
दो.
निकाल के फिर उसी को
उसी पॉइंट पे कर सकते हैं ना?
हाँ. If you see this treatment as a wet cupping method, you have what we have did. We have infiltrate the muscle. We have increased the blood supply. Toxin बाहर आ चुके हैं, and now muscle has empty space. So you can check the tone for both sides.
Oh. God.
Yeah, this is blood and this is toxin. See, the cotton is not able to absorb that. Only like 3 to 4 ml of blood.
now tronic.
Increase the pressure, time, and the heat. Heat concerning main time, negative pressure in this. On negative pressure almost set था. It was 1. तो इसको दोबारा 1 कर देते हैं. Time you can change accordingly. And just you have to draw.
डायनामिक.
Yeah, dynamic cupping. But this is for only bigger surfaces. छोटे surface पे आप use.
सिलिकॉन कपिंग थेरेपी
कैसे करेंगे? मतलब
जिसमें स्क्रैच या फिर साइन निशान नहीं आता है, ये ज़्यादातर सेलिब्रिटी स्टार कराते हैं क्योंकि उसके बॉडी पे स्क्रैच वगैरह नहीं आए.
Used for dynamic.
शुरू करिए.
सर आई गेस सबका प्रिंसिपल तो एक ही है, चाहे आप नॉर्मल से करिए चाहे किसी से शो पीस है.
ऐसा यूज नहीं करते, उनका अपर्चर बहुत छोटा रहता है. So they are going for a limited area. So वैक्यूम में क्या है? Place. And you can go them with them also. But pressure बहुत कम है. Pressure will be very less. सेम फैंसी स्टफ और कुछ नहीं. उठिए मुझे भी कराना है इसलिए मैं करा रहा हूँ. बाकी मैं रिकमेंड नहीं करता. पेशेंट है थोड़ा कंसर्न है स्पॉट्स के बारे में कि स्किन पे मार्क्स नहीं आने चाहिए, देयर वुड बी नो स्टैग्नेशन, देन यू कैन गो फॉर द सिलिकॉन कपिंग और यू कैन सी द नॉन स्टैग्नेशन कपिंग. इसमें मार्क्स नहीं पड़ते. थोड़े बहुत रिदम में आएगा, वो शाम तक चला जाएगा. एफ्लोराज यू कैन से. उसमें आप इतना एफर्ट लगाएंगे, एक
ड्यूरिंग फेशियल पाल्सी कंडीशन।
हमारी मेहनत ज़्यादा है।
नहीं, कम ही अल्टीमेटली एफ्लोराज से तो कम ही है।
अच्छा
सी यू कैन गो क्रिस क्रॉस, इरेगुलर सरफेस यू कैन कवर। Yeah.
पैसा नहीं देगा उसके लिए।
उसके लिए ये। जो बार्गेन करे उसको ये, नहीं तो बाकी को बैठ। राइट, ये लीजिए, लगाइए इसके बाद ऑयल सैचेट। देखिए है उसमें तो मिल गया। खाली था क्या? Right? You can use any essential oil and move. See the rhythmia? माइनर rhythmia आएगा, ज़्यादा नहीं करना, अदरवाइज वो स्पॉट रह जाएगा, ऐसे कैसे भी बनाया हो आपका। राइट,
इसकी भी डायरेक्शन होगी कोई?
अकॉर्डिंग टू मसल। अब जैसे फ्रंटल पे करना है, विल अप्लाई ओवर हियर एंड पुल टुवर्ड द हेड।
ओरिजिनल इंसर्शन वाला?
हाँ, वो
या
सेम
फाइबर्स
के अलॉन्ग ही जाना है आपको। साइनोसाइटिस के लिए यू विल गो टुवर्ड द ईयर मेटिस, लिया, अटैच किया, मूवमेंट टुवर्ड ईयर मेटिस। अब बेल्स पाल्सी में क्या है, एक साइड आपकी श्रंक हो जाती है, राइट?
होगा ही नहीं अभी।
तो उस साइड पे आपको करना है, और जो साइड डल है वहाँ पे स्ट्रेटनिंग कराते हैं। अब जो भी, तो जो रिलीज वाला पार्ट है वो आप इससे कर सकते हैं, राइट? ये आपका हो गया साइनोसाइटिस, ये आपका हो गया बेल्स पाल्सी, राइट? एंड दिस फॉर द फ्रंटल पेन और द क्लस्टर पेन। आइज के नीचे शुरू करेंगे एंड मूव टुवर्ड द मिडल ऑफ द हेड फॉर क्लस्टर पेन। ये लीजिए, अप्लाई करिए। हाई सक्शन कपिंग, स्ट्रेट बेल्ट पे लिया। सो दिस इज योर हाई सक्शन कप, राइट? ये मूवमेंट पोस्टीरियरली, एक सेकेंड, आराम से सामने देखिए। Yeah, so you can add the resistance training with the cupping also, right?
फ्रोजन शोल्डर में और स्टैंडिंग और
Yeah. Frozen में, deltoid rehab में, सब में यूज हो सकता है। Like you can do this for a warm up, right? If you are doing the deltoid rehab for someone, so you can warm up the shoulder with this thing. Like only this. A high suction cup will be used.
if we increase the suction of pressure of the
Yeah, इसका प्रेशर नॉर्मल से ज़्यादा है, बहुत ज़्यादा है।
ये टॉर्सियन है ना सर, वो फेशियल रोटेट भी कर दिया उसने।
साइडवेज। हाँ, राइट? So you can go for these things as well. एक निडल के साथ भी होती है कपिंग, बट वो इफेक्टिव नहीं रहती, बिकॉज अभी हमने मॉर्निंग में बात करी बीटा फाइबर्स एंड डेल्टा फाइबर्स। सो बीटा फाइबर्स हैव द कैपेबिलिटी टू रीच ऑलमोस्ट 100 out of 60% effectiveness, but your delta fibers have the 100% effectiveness at all. So if you are using needle and the cupping at the same time, then maybe more chances, almost 99.99 chances that the dry needle is working only. So जो needle लगा के कप लगाते हैं वो इफेक्टिव नहीं है, आपको इफेक्ट निडल का ही मिल रहा है, कब पैसे लगाया जा रहा है, राइट? एक चीज़ हो रहा है वो कर लेते हैं। सुपाइन लाइन तो शॉर्ट में कौन था? यार वैसे अलग से ले, जेब में रख इसको। गन पंप कर, पंप तो यहाँ पे कप्स रिमूव होने के चांस ज़्यादा है when we increase the pressure.
when we increase the pressure
Or when he lifts the leg. Yeah, lift. So it can increase the pressure of the muscle and give you a decompression force.
स्ट्रेचिंग हो जाएगा।
दोबारा करो।
Hamstring with calf.
Right? So patient has to be active, but patient को एक particular extent तक ही जाना है, and then only the knee movement. जो भी आपका प्रोटोकॉल है, isometric, eccentric, वो आप सब करवा सकते हैं, right? Yeah. You will get like same you will get the response. So जो rest of the बच गया है वो आपको next day करना है, and you will find a good circulation. ये आपका partial cupping है.
और pale color skin.
Yes. Pale color, pale white and pale yellow for both. Golfers. And यहाँ पे आपको dynamic करना है in between. Till the CTS point. Right? Static, dynamic both.